I think the three key points that people can really benefit from if they, as far as pre-planning for long-term care, for subacute placement, for rehab, the first would be just the aesthetic cognitive part of the transition. It's very difficult for a family or for a loved one or for a caregiver to have someone in the hospital and then have the hospital and have the doctor say, you know, it looks like we're going to need either subacute placement for some rehab or indefinite long-term placement. And that transition is very difficult for most family members or for most loved ones of a potential resident. And so if you have been proactive, if you are caring for a loved one or for an elderly family member, if you've already been proactive and you've gone into the community and you've looked at facilities at all levels, whether it be the assisted living or a rehab center like we are, or long-term placement as well, when the time actually comes to where you have to make that choice, then you've already alleviated that level of pressure, and you already have established a comfort level by finding a facility that you like the layout of, you like the medical staff, you had time to research all of the elements of the facility. So that right there we see with family members and with loved ones and caregivers. When it comes time for the actual event of the transition to happen, we see that if they have already been proactive and they've already researched, they've already toured the facility, they've already talked with us in administration, we're very much amenable to having folks come in, talk to our medical staff, talk to our nurses, our CNAs, talk to our dietitians, our folks in social services. We want everybody to have a comfort level here to let them know that we are going to take care of their loved one to the best of our ability, which obviously benefits the resident, but more so it gives that aesthetic comfort level to the cognitive security to the person who has to make the adjustment, who has to make the transition. The second element, I think, that really supports the idea of pre-planning and looking ahead in the community for different levels of care, for options for folks that are going to need different placement outside of the home at whatever level, obviously are the medical concerns. If by the time someone reaches us here, they either have a rehabilitative need, to which if you've done your homework and you've done your legwork, then you will know that, like here in our facility, you'll know what we offer as far as physical therapy, occupational therapy, recreational therapy, and speech therapy. You'll know what kind of staffing we have. The folks would be able to find out some background on our therapists, and to really get an idea of what is going to be available to their loved one while they're here. The third facet of a transition that can really be positively dealt with and attended to comes from the financial end of things. When the reality is, when a loved one has a family member or someone that's in need of placement, whether for just a short-term stay or a long-term stay, they look at all of the medical and all of the aesthetic issues that are at hand right at that moment, if they're going to get any better, how we're going to work with them on a rehabilitative status, that type of thing. And it sort of comes as an afterthought, the realities of the financial end of things. What we see a lot of the time, unfortunately, are families who have not pre-planned. They have not researched the system. They know virtually nothing about Medicare, about Medicaid, Title 19, about private insurance, and about private payment for facilities. The rules, if you will, for Medicare and Medicaid and Title 19 are very different when you're in a facility versus when you're out in the community. So it would be very advantageous for people in the community, before they have an actual placement need, to go ahead and do some research.